I want to talk to you in a moment about the thing I just spoke to Chris Smythe about, the whole question of tracing and tracing of contacts and testing and tracing of contacts and what it might mean for our privacy. Just interested to get your thoughts on it, really. But PPE has been much on your mind, hasn't it? On everybody's mind for the last few weeks. Tell us about the situation in Greater Manchester, because you took matters into your own hands a little, didn't you?
We did. So we set up a central team in Greater Manchester, Sheila. We're the only part of the country that has a health devolution agreement. So we've got more control over our own health service and obviously other public services too. And they've been working away, trying to buy on the open market, fighting off countries and US states and all kinds of things. It's been, I'm afraid, a bit of a cutthroat market out there. But they've succeeded in bringing in many millions of items. And we just brought in 1 million masks yesterday to Greater Manchester. So, this isn't us just looking after ourselves, although we are trying to look after ourselves. Of course, by bringing in more ourselves, we can relieve the pressure on the national stockpile, and that can get to other areas as well. So I'm really proud of the team. They've done a good job.
And what problems did you face, though? Because as I understand it, as you said, it's a cutthroat world out there when it comes to finding these vital supplies. Give me an example of any obstacles that were put in your way or got in your way.
Well, obviously items that would have cost a few pence all of a sudden were costing pounds. There's been some real sharp practice, I'm afraid. But it also, getting gazumped at the last minute, as I say, by other European countries and other places. So, it's been a hard thing. Deals being done in airports and all of a sudden being reneged upon. So it's been a horrible situation, really. But it also, though, has worked because we've had stuff brought in. We haven't always been helped by the bureaucracy, Sheila. We had 500,000 masks come into Heathrow this time last week, and they sat there all weekend, Monday, Tuesday, Wednesday, and finally they arrived yesterday. And I'm afraid that was border bureaucracy that stood in the way of that, which is madness, isn't it, at this time? So
it is.
Yeah.
I mean, you'll be familiar as a former health secretary. You'll be familiar with mad bureaucracy, I'm sure, but you'll be familiar with things like the NHS's procurement processes. And it struck me, I didn't have the answer. It was more a question than an answer, really, a few weeks ago. I just thought to myself, I wonder whether what's blocking this and stopping the government from being a bit more fleet of foot about PPE is that they are stuck in systems that they've always used and aren't yet able to be flexible enough, or can't legally, or whatever the reason was, to get out of those systems and be more agile in problem solving.
I think there might be an element of that, but actually I would say it's possibly the opposite. So if you go back to when I was in that role, there was a more national system of procurement. It was very nationally driven. And when the reorganisation came along in 2012, I think it disrupted some of that supply line and those logistic systems. So it's a complicated picture, Sheila, as ever, and no one's kind of coming on to say, "Oh, it was all right in our time and it's all rubbish now." It's been a
no. That's not what I'm suggesting. That's not what I'm suggesting. I'm suggesting that actually procurement processes and that kind of stuff, particularly in huge organisations, it's often a system that people get used to. In any big organisation, people, for goodness sake, I worked at the BBC for a quarter of a century. People get into systems that they are used to doing, and it's the way it's done, kind of thing. And people do lose a flexibility, I think, yeah.
To a degree, but obviously our National Health Service is more organised when it comes to procurement than most of the health systems around the world. And I think the uniqueness of this moment we've been in is that all health systems have been fighting for the same stuff. And, I do sympathise with the Health Secretary because of that. It's such a tough environment. And we found it tough in Greater Manchester trying to break our way into it. But no, I think on the whole, the NHS has better systems. I think the questions to be asked afterwards will be, were we topping up those pandemic stockpiles? Because we have had stuff in warehouses in the event of this. And I think there's a question to be asked, were we replenishing that stock and updating that stock in the event of this?
Can I ask you, with voters in Greater Manchester in mind, really, when I ask you this, if the government brings in this testing and contact tracing, South Korean style way of managing COVID after the full lockdown that we're in at the moment, what will your message be to voters in your region if they say, well, reassure me about my privacy here. I'm handing, in a way, my private life over to the state in order for them to protect me, yes, and others, but still, how will it be protected? I mean, there's a lot to look into here, isn't there? There's a lot to protect, actually, in the long term.
Yes, lots of things to be kind of traded off, if you like. But how will I persuade them, Sheila, was your question. It's the greater good, and the greater good is the health of the people, isn't it? That's got to be at the very, very top of everything. And we look at Germany, we look at South Korea, and clearly they have had better systems to do these things. And, the argument is, of course, if we have a better grip on testing and on contact tracing, we can give people more freedom back to live their lives again. So, it's a complex set of arguments, but I certainly tasked my team in Greater Manchester yesterday to come up with a contact tracing system that's going to be right for us. We've had a bit of a problem, I think, in recent weeks of systems being imposed from the national level that haven't quite worked properly. And we want to design this one from the bottom up, if you like. So I'll give you an example. We were not consulted, and the government put in a testing station at Manchester Airport. Well, the truth of the matter is, it's not easy for NHS staff or social care staff to get there. And it's when you kind of design things top down and put them into places, often they don't work. When it comes to contact tracing, let us develop this system according to what's right for us. Let us persuade our own public with the arguments that will make it work. And I think that'll be a better way to do it, Sheila.